Meanwhile, the ranking Republican on the Senate Finance Committee all but admitting that he's going to vote against his own bipartisan health care bill no matter what's in it because other Republicans are going to vote against it too. Senator Chuck pulled a plug on Grandma Grassley, previously of I'm no nail infamy, telling Msnbc this morning that whatever bipartisan legislation eventually emerges out of committee in the Senate will be a bad deal by definition if he cannot get a lot of his fellow Republicans to support it.
I'm negotiating for Republicans, and if I can't negotiate something that gets more than 4 Republicans, I'm not a very good representative of my party. It isn't a good deal if I can't sell my product to more Republicans.
As for how Senator Grassley and his fellow Republicans really feel about the product that is the public option, the lawmaker today calling the government a predator.
When you got the government running something, the government's not a fair competitor. The government is a predator, not a competitor.
Let's turn now to our own Lawrence O'Donnell, contributor to the Huffington Post, former chief of staff to the Senate Finance Committee. Good evening, Lawrence.
Good to be here, Keith.
All right, if a Republican negotiating the health care reform bill in the Senate is now admitting he's got no intention of voting for that bill that comes out of the Finance Committee, no matter how good it is, no matter what is or isn't in it, why in the world has the president negotiated with these people? Why not just put the best bill forward, let alone give away something or hint at giving away something as big as the public option?
Well, the strategic question is always, when do we abandon negotiations? And with someone like Grassley, it's tricky. You know, he has to make certain noises that appeal to his Republican base and appeal to his right side. I, for example, believe he voted against Sonia Sotomayor to shore up his credibility with the right side of the Republican Party for doing this kind of negotiation. But the things he has started to say recently are very, very disturbing. They should be disturbing to the White House. They should be worrying Chairman Baucus that this starts not to sound like someone who's coming back to negotiate in September. If that's the reading they make at this point, then they really do have to abandon the negotiations and start thinking about what can they achieve by just pushing a bill forward with Democrats. But that's a scary prospect because what you can achieve with Democrats alone does not look good right now.
Well, evidently it doesn't, because much of the problem seems to be coming from the Democrats, including the chief one at the moment. In his op-ed over the weekend in the New York Times, instead of taking on these Republicans, the president seemed to make another appeal for bipartisanship. What he wrote was, let's make sure that we talk with one another and not over one another. Has he misjudged who he is dealing with in this equation, even if you don't want to consider it a fight, just an equation? Because this is the first time I have ever looked at him and politically wondered if he has any idea what's going on here.
He has completely misjudged it, but so has the White House. This is not his fault. He is following the conventional wisdom of the leaders in of his party in the House and in the Senate, and his staff in the White House. And the lesson that they don't get here is that they compromised at the outset, Keith. They didn't go for the best bill at the outset. The president said that if he was doing this his own way, it would be single payer. It would be effectively Medicare for all. He would be with those 100 House members who want Medicare for all. But he compromised right off the bat to go to something that would preserve the private health insurance industry, and tortured that thing into a shape that they thought would be acceptable to the middle of American politics. All in the fear of, if they went for Medicare for all, they were terribly afraid of being called socialists. Well, we see where that got them, trying to go over in this direction into this tortured way of supporting an industry that doesn't work. They are now still called socialists for having preserved the medical health insurance industry.
The bully on the playground is going to beat you up whether you fight back or not, is the lesson I think we all tried to learn in the 4th grade. And if you don't learn it in the 4th grade, I guess you'll learn it when you're in the White House.
Exactly.
Now, it is,
and, you know, Keith, the idea with the wise men is that, you know, we'll never be able to get single payer. We'll never be able to get Medicare for all. My experience, having failed at this kind of legislation in 1994, when I look back at it, there's a lot of people who try to blame Hillary Clinton for making different mistakes at different times. And she made all of those mistakes, but I don't think it mattered. I think we were going to get nothing in the end because the basic concept of what we're trying to do was flawed. And what the Democrats should have been doing for the last 15 years after that defeat is selling Medicare for all. And maybe 15 years later, 15 years after that, maybe with the election of this president, the Congress would be ready for a clean yes or no vote on that question.
All right, so if
that would be worth fighting for.
All right, what does he fight for now? The best he's got right now is a reconciliation bill in the Senate, and hopefully not losing 100 Democratic votes in the House. What can he achieve now?
Well, you see exactly where the problem is. Anthony Weiner is warning him, if you go too far in their direction, you're going to lose us. In reconciliation in the Senate, I don't see anything good that can come out of that. There are so many ways to prevent elements of health care reform passing in reconciliation, requiring 60 votes to include those provisions, that what you would get out of it would be a very ugly-looking sausage.
Lawrence O'Donnell of Msnbc and the Huffington Post. Great thanks, as always.
Thanks, Keith.